I hope you had fruitful discussions in the interactive sessions and you made sure that your voice is heard. And today we have one more panel before we are coming to the end of this conference. One more panel and connected parallel workshops. So there is still a chance to contribute. In this panel session today, we would like to share stories and ideas about inclusive approaches to healthcare. Yeah, so healthcare indicators are improving all over Europe, and that's a good news. But are they improving for everyone? Or is there anybody left out? Health, we would like to hear about indicators, the statistics and averages, but they often hide healthcare experiences for those farthest behind, for the most vulnerable. So today's session, in the panel, we're going to hear first a short input from Amanda Schreiweis. Yeah, and then, she will give us an interview about healthcare exclusions and some examples from the region, hopefully. And then we will dive into the experience of young people connected to healthcare. We will hear some stories. It's kind of a storytelling activity that we're going to have here. Yes, and you will hear from Sam and Jana and Theodora afterwards. I'm going to introduce them a bit more when it comes to their input. Yeah, so let's start with our introduction. Yeah, so Amanda Schreiweis is with Y4H European Office for Investment for Health and Development. She focuses on the shift towards well-being economies, particularly at the intersection of mental health, social inclusion, and young people from 18 to 30. She is a research fellow at the University of Bremen and an international visiting professor at the University of Kansas. So can we hear from you, Amanda, what data says about exclusion of young people in healthcare in Europe and Central Asia?
Absolutely. Thank you so much, Zora, and it's a real delight to be on the panel today and here with all of you. I know it's been a fruitful several days, so thanks for staying with us. And like Zora said, I'll do a little bit to set the scene, give us a little bit of data, and then, as ever, we want to hear directly from our young people about their lived experience with these issues, and I know we'll be talking about that more in the workshops as we go forward this afternoon. So in our office that focuses on investment for health and development in the European region, our head of office has been engaging with young people over the course of this year as well. And I'd like to start with an opening that she's used with many of these presentations. Her name is Chris Brown, and she's very supportive of this work and eager to see it moving forward. So when we get up in the morning, oh wait, it's fine, sorry. So when we get up in the morning, how well we feel depends on if we feel safe in our homes and in the communities where we live, if we have people in our lives to celebrate our successes with us and to ask for help when we need it, and who need us in their lives to do the same thing. If we have a purpose to our days, such as a decent job that we love, training and learning that interests us, volunteering in our neighborhoods, or participating in activities that inspire us in issues that we feel connected to personally. But if we wake up feeling worried about not having a job or not having financial independence in the future, facing long hours for little pay, exposed to discrimination, fearful of violence or the threat to being homeless with no one who needs us or to ask for help, we know that our health, and especially the health of young people and their mental health, will continue to suffer both now and over the life course. And so we're going to start today with a picture of these impacts for young people and just a quick look at some of the data that we have available. All right. So on this slide, you can see figures across a number of statistics, okay, for illness-limiting daily life, poor life satisfaction, poor mental health, and also poor self-reported health, okay? And the figures are separated according to men and women on both sides, or males and females specifically, as I should say. And they present differences between the top 20% in the society according to income and education and the bottom. And as you'll see across all of these figures, we're seeing more people at the bottom 20% of youth struggling between the ages of 16 and 29 across Europe, okay? And struggling in different kinds of ways. So in the figures on the left and the right, with respect to illness limiting daily life and also poor self-reported health, you can see that there are gender differences in how many people in the bottom proportion of the population there in the 20% are struggling, okay? And we can see that with illness limiting daily life, 3 times as many females in that bottom 20% bracket are struggling compared to those at the top, okay? And even still, 1.3 times as many males in that bottom portion are struggling with illness limiting daily life. And we know that this matters because it puts young people and families at risk of poverty and social exclusion over their life course, okay? And when we look at the far right, with poor self-reported health, we can see that 4 times as many men in that bracket at the bottom 20% are struggling for young people compared to the top, and still over 3 times as many women, right? So these differences are gendered, and we're seeing those gaps grow as a result of COVID in some cases. There are also places where the figures suggest that gaps for males and females are not as disparate, and yet we still see, again, this bottom 20% struggling, and we see this with the statistics in the middle for poor life satisfaction and poor mental health, okay? But this doesn't mean that there aren't gendered patterns in these issues. We know that there are, right? So for mental health across the region, we tend to see more females struggling with depression and anxiety, and more men struggling with suicide. And we also see gendered patterns in how young people seek help, right? How they try to access assistance, both socially and informally, and also how they seek help for health services in a formal capacity. So, go on. So we know that for risks to youth health and well-being and social exclusion, there are many, okay? And this includes health and health services in the health sector, and also many issues beyond the health sector that we have to think about when we're talking about health inequities, okay? So on the far left, we know that inadequate access to good, quality, affordable health services impacts these inequities that young people are seeing and feeling and facing every day. And we'll talk about that at the end of this presentation in a little bit more depth. But we also know that things like income security and social protection, quality housing and affordable housing, as well as access to appropriate food and fuel and safe neighborhoods matter for the health and well-being of young people. We also know that poor quality education, or not trusting and feeling belonging, and that you can access political and also social participation in the places you live, also negatively impacts health and well-being and creates inequities. And finally, job security and poor working conditions also impact the health of young people, not just in the short term, but also in the long run over the course of their lives. We're very aware of this, since this is something that we're focusing on a great deal. So we know that going into COVID, and even more since, around 25% of young people in the European Union were significantly at greater risk of feeling the effects of poverty and social exclusion, with substantial impacts for housing affordability, their financial security over the life course, especially those 2 issues. We also know that support packages that were put in place during COVID didn't target young people as much as they maybe should have. And in 11% of cases, young people were not receiving support at all. They weren't receiving any support from the kind of recovery, planning, and value preservation efforts that were going on across the region. And while those efforts were substantial, they just didn't reach enough people, and we're aware of that and want to do more. We also know that in countries in Central Asia and the Caucasus, for example, only about maybe 6 or 7% of unemployed people received benefits or assistance, and this is compared to as much as 70 or over 95% in Eastern and Western Europe. So these differences across our full European region are large. We need to do much more to close these gaps, because we know that these differences matter for health and well-being. We also know that young people are struggling to remain economically active, and that we're seeing greater numbers of them who are not in employment, education, or training, which is of great concern, I guess, again, immediately, but also over their life course. And during COVID, we saw 5 years of backsliding in progress to address this issue since the 2008 financial crisis. So this is high on the minds of policymakers going forward. Now, these differences in health inequities and risks to health are also impacted by what we call intersectionalities. And I've heard and know that this term has come up in a lot of presentations throughout the week, and I'm expecting that it will rise again later this afternoon, so I want to talk a little bit about this. We know that the ways in which young people are facing disadvantage and struggling to make sure that they have equitable access to health and health care over their life course are impacted by these many intersections. Okay, and intersectionalities are areas where we know that existing power hierarchies of privilege and also disadvantage result in inequalities and differences in people's health outcomes now and again over their life course. And these intersections come together in different ways for different people across a lot of dimensions. And some of them we've already talked about today, and some of them we'll touch on, both through the lived experience of the people on the panel and also in the workshops going forward this afternoon. So these various intersections, as the slide shows, include ethnicity and race, class and income, sexual orientation, your biological sex, your age, diverse kinds of ability, gender identity and expression, right? So all of these factors come together in a unique way for every individual. And this matters both for the lived experience side, as we've talked about this week, and making sure that healthcare services and the health sector is connecting to young people and their lives and experiences and reaching them to address these health inequities. That's a big piece of this puzzle. But we also know that these intersections matter for policy and institutions, right? These intersections are affected by the way in which we design our support systems and by the way in which our institutions operate and how policymakers come together to address problems that young people are facing and also to address these factors that are placing young people at risk of inequities, right? Including in the area of health. We'll talk a little bit more about this. So overall, the message here is that poor health increases the risk of poverty and social exclusion, and we know this. We've known this for a while, right? And we're going to talk about new solutions today to address this. So when young people face these risks of poverty and social exclusion, they also cannot care critically for those who depend on them. And this is a key life transition that people between the ages of 16 and 30 are facing. Many of them go from being legal minors or children, sometimes dependent or reliant on other people to care for them, to being caregivers, right? They may have children of their own, or they may have more people that they're looking after who are in older years. And if we don't invest more in young people, they simply will not be able to shoulder this intergenerational care burden. And in some disadvantaged situations, young people have already been doing this in their home lives, throughout their lives, right? So we've got to really be careful about this because our ability to care for one another hinges a lot on young people. And this is really critical going forward, and policymakers are aware of this. And it's also critical for the wider society and economy. If I can get the next, there we go. So specifically with respect to mental health in young people, we have powerful figures about how much this matters, right? We know that mental illness alone, which is disproportionately impacting young people now since COVID, costs EU countries more than 4% of their GDP every year. Okay, and depression alone is estimated to cost about 136.3 billion euros a year. So this is an expensive problem for people in addition to being a rights-based issue on its own. And as we know, this impacts economic growth. It means that young people are unable to be as economically productive now and in the future, and they'll have reduced wages largely as a result of these impacts. And it also leaves them in a position where they're unable to contribute to tax revenues if they're not earning as much. And it places additional pressure on public resources, including healthcare systems, which we know are vital to continue investing in after the pandemic, right? So all of these factors come together, and it's important to consider the many, many dimensions of this. For today, we're going to come back to what exactly the health sector can do about this, right? How do we get young people included to have more equitable health outcomes now and over their life course? We know that there are many different ways that young people can be included or excluded from health and care systems, okay? And I'm just gonna introduce a couple of different types of mechanisms along these lines. And then we wanna turn it over to the young people to hear about their lived experience and how this is happening in their day-to-day lives. So first, we know that there's an issue to do with availability and coverage, okay? And that's the pink line at the bottom of this kind of complicated figure on the left, right? So if the services aren't available, young people just can't reach them. So that's sort of step one, is making sure that we have them provided, right? The second is accessibility. So the healthcare clinic might be there, but can you get there? Can you get in the car and drive there? Can you access the public transit, ride your bicycle? Is it safe? All of these issues, right? If you can actually access the care. The third is acceptability of coverage, right? And this has to do with issues that young people have raised sometimes throughout the week of any negative experiences you may have had when you've interacted with the healthcare system before. Have you felt discriminated against? Did you feel that you weren't respected or taken seriously or getting adequate care or coverage, right? So acceptability of coverage is really important, and especially I'm interested in hearing a little more about that from young people. Also contact coverage. So, who's actually using the service? This is the point at which young people actually make it to the health facility, service provider, and then they actually get, hopefully, the care that they need, right? And then we want to know the final rung of this sort of service delivery goal is effective coverage. Is that care, does it meet your needs? Did it give you a positive experience, right? Was it quality care? Would you go back again? Would you recommend it to others, right? These are all things to do with effective coverage. And we want to know what makes that experience better and more positive for young people. And throughout all of these dimensions of coverage, right, intersections matter. Okay, and we're going to give one example with respect to gender on the right here. So it matters who has access resources to get to that facility. Do you have a car? Do you have public transit? Safe bicycle? Again, who has those to actually facilitate this access, right? And that distribution matters for who can get to the care. Also, how is the labor shared? So we know that there are a lot of women who are workers in the healthcare sector, and there are gender differences in the healthcare sector itself, right? So who's providing the care? And also who's caring outside of the health sector, right? We know that people at home and gender differences there also matter for people to be able to actually leave jobs or formal or informal work to actually get to the health center, right? So there are things inside the health sector, but also outside of it that are also gendered that matter. And social norms also matter, right? Who do we see as deserving of care and when and why? And then finally also who's making those decisions around the kind of care that you need and whether or not you should get it, right? These things all really, really matter for the health of young people and really for the whole population and society. So I really want to turn it over there to young people, because one thing we need to do is unlock solutions for better health and a better future for all young people across Europe. And this is what these sessions today are about, so we can get input on how to do that and close gaps. And from the work we've done so far, we know that inclusive healthcare and building economies of well-being, right, creating these wider societies and economies that allow young people to thrive, go hand in hand. So we have to do these things together to create a better future. We know that youth engagement, leadership, and partnerships across a number of sectors are absolutely critical to doing this. And in order to make their vision a reality, we have to talk to them, right? So really, I'm interested in hearing today about the lived experience that young people have had with these issues, what's gone well, what isn't going well, what we can do more with. Also hearing a lot about what you're already doing to find solutions, how you're already coping, how you're already moving forward, the changes you're already making, because a lot of these things are already ongoing and being driven by young people. And also what you want health professionals and policymakers to know about how they can help to close these gaps and provide greater supports to the efforts that are already being made with attention to those who are most at risk of being left behind. That's it. Thank you so much.
Thank you very much, Amanda, for the context that you created for us. And I'm also very eager to hear the stories from you. But before that, I still have two questions, just as in the previous panel session for you. If you could somehow indicate, if you can, it would be nice to stand up or just, indicate somehow, hands raised or whatever is comfortable for you. Do you consider healthcare reasonably inclusive in your country? Yeah, reasonably is, the tricky word here. But do you find it okay, inclusive in your country or not? If you find it okay, please indicate with your hand or standing up in some way. Yeah? I can see like 1/10 maybe of the room raising their hands. This means that you identify problems. You see some inequalities in the system, if I understand correctly this representation. Then the second question would be multiple choice. So again, you will be able to indicate somehow your answer. What is more important, in your opinion, to make healthcare more inclusive? And there are three options. I'm going to tell them before and then ask one after the other. So A, better awareness. B, better practices and attitudes from providers. C, more money. So what is more important to make healthcare more inclusive? Who goes for A, better awareness? Very few hands, 3 or 4 hands I can see. Who goes for B, better practices and attitudes? Okay, that's half of the room or even more. And then C, more money. 1/3. So I think the majority voted clearly. I can't see numbers, obviously. That's not really an exact statistics, but I think we can all see that we all think, or not all, but more than half of the group thinks that better practices and attitudes would make a big change in making healthcare inclusive, and actually not money. Money seems to be also important, as 1/3 indicated, but that's not exactly the only thing that we are missing in this context. Yeah? So thank you very much for sharing. And now I'm very curious and I want to hear from you. And we are going to start with Sam. Okay? So Sam is an 18-year-old, he's 18 years old and joined Special Olympics Malta in 2012 in the aquatics team. The Special Olympics Malta gave him many experiences locally and abroad, not only in different competitions, but also as a Special Olympics health messenger. Welcome, Sam. And the question to you, the first question is, Sam, could you please share your personal experience when visiting a health center? What made this experience easy for you and what made it difficult for you to get your concerns addressed?
Well, good morning. First of all, I would like to start by thanking you for this amazing opportunity. Not long ago, I had accidentally stepped on a nail and it got stuck in my foot. My mom had taken me to the local healthcare center and I couldn't walk. I had to be wheeled into the waiting area. And the waiting area was quite noisy, crowded, and with blaring white lights. I had to wait for 30 minutes in this environment, anxious and in pain. After 30 minutes, I was admitted to a room with 4 couches divided by a curtain. When the doctor came up to me and started asking me a series of questions, one of them being if I had taken my tetanus injection. Luckily for me, I knew what tetanus was. And I was taking a long time to answer the doctor because when I'm overwhelmed, my processing speed slows down. That's why I have these notes with me today. The doctor kept asking me more questions, one after the other, without giving me time to answer. This frustrated both me and her, and I blocked even more. My mother was with me, and when she noticed that I was becoming overwhelmed, she answered the doctor herself. But the second she answered the doctor herself, the doctor only talked to my mom. I had the right to be addressed. I was the patient. I was the one who was going to care for my wound. I needed the information. I was 18 years old. Had this episode happened during COVID time, my mother would not have been allowed with me. Or had it been another person, or my brother, who also has ADHD, something as simple as this could have triggered a meltdown that could have been interpreted as the person being violent. In fact, the fact that my mother was present with me made this experience easier. I could keep calmer and less anxious. Having her answer the doctor when I got too overwhelmed helped too. However, this whole experience could have been made better if the waiting area was smaller and less crowded, had a softer shade of light been used, and the noise was kept lower. Should I have had more privacy than a curtain, I might have felt more comfortable explaining to the doctor about my ADHD and processing speed challenges. And last, but maybe most importantly, education to the healthcare professionals about various intellectual disabilities and how these might affect people differently.
Thank you for sharing, Sam. So in case you have this opportunity to change the situation and make young people better served and better informed regarding their health, what will be your suggestions?
Special Olympics follows a mission with a common agenda, doing their utmost to empower the Special Olympics athletes, an agenda which focuses not only on sports and physical activity for the athletes, but also on the importance of reaching out to as many people with intellectual disabilities as possible. I am a Special Olympic athlete, voicing and representing my fellow athletes. Most of our athletes face a challenging life due to their conditions, disorders, illnesses, and their poor health. Some also feel troubled, worried, concerned, and a feeling that they have to depend on their families and loved ones. Sometimes we feel that we are a weight on society. We don't want this. We want to be part of our community, part of our society. We want to feel counted. We want the same treatment, the same understanding, the same life, even the same opportunities. How can a person with or without intellectual disabilities be of a contribution when he or she is being neglected the benefits of wellness and good health? When my mentor spoke to me about health equity, I hesitated for a moment. Isn't the healthcare system designed to provide individuals with a service that improves health outcomes? I decided that this was a topic to discuss with the Special Olympics Malta Athlete Leadership Committee to view their opinions too. In Malta, our healthcare system is quite a strong one and luckily offers free service for every Maltese citizen, but there's always room for improvement. We strongly believe that to achieve health equity, it requires involving everyone, starting from an educational level, especially to university level. Some of the problems that people with disability encounter that I would change would be the accessibility issues. Individuals using wheelchairs passing through narrow spaces or having to open doors, or even going up ramps without any aid or assistance. No adequate changing tables, like changing tables aimed for adult patients. People with disabilities attending outpatient appointments end up having to stay soiled until they return home, creating discomfort and also an embarrassment. The lack of communication. The communication not only between specialists and patient, but also between the specialists themselves. There are occasions when the patient with a disability is being seen by different specialists due to their where was I? due to their medical conditions and complications. Lack of communication between the healthcare professionals themselves can cause further problems for the individual. The healthcare professionals. Students go through intensive academic training during their state university and even must follow a form of internship before actually achieving their full certification. But they're not provided with enough training when it comes to address people with intellectual disabilities, resulting in lack of empathy and understanding to the detriment of the individual. In the future, healthcare professionals had to choose who to deal with or to follow, they would refuse to treat individuals with disabilities. A case that comes to mind is another athlete's experience. She was denied a nebulizer as the healthcare professional misdiagnosed an asthmatic attack for a challenging behavioral episode. Another athlete who needed an urgent surgery had to wait because there was no one who knew how his disability and how to handle the situation. Another athlete told me an incident related to another family member of theirs. His cousin had a toothache and required a simple filling. An appointment was set where he was sedated to carry out the procedure. Once the whole ordeal was over, the dentist informed the parents that they had to remove 3 teeth and stated, "Better this way," so that he wouldn't suffer in the future. From a simple toothache, he now has 3 missing teeth. Healthcare professionals are not trained to handle people with intellectual disabilities, individuals with challenging behavior, for example, autism. One must realize that going to a hospital appointment can be a very traumatic experience for an individual with intellectual disability. Even the environment in a typical healthcare system is relatively a bright one, with very bright white lights, which can be a trigger for several people who may become overwhelmed by the heavy white lighting. There could be a separate waiting room for people whom the very bright light could be a trigger and possibly less crowded. I strongly believe that privacy is often overlooked. A person with intellectual disability in private would be more comfortable to talk about their disability and their needs. Noise. Another issue I see is the level of noise witnessed within the waiting rooms, where aside of making a person with intellectual disability more anxious, it creates an environment where we are unable to process, think, answer, or even cooperate. When we speak about health equity and equal opportunities, the first thing that comes to my mind is, why should there be any health differences? Shouldn't health be equal for everyone? Thank God I didn't pass through difficult health problems, but when I heard the stories of other athletes and what they went through, I was shocked. We must keep in mind that a person with intellectual disability may have more medical needs that need to be addressed and identified. This means that the world needs a better healthcare workforce that is trained and provides compassion and sensitivity during special healthcare needs. Achieving health equity means accomplishing the highest level of health for all people, where everyone has a fair and just opportunity to healthcare, regardless of their race, ethnicity, disability, sexual orientation, gender identity, etc. Policies and programs that support health for all people need to be implemented to eliminate and avoid differences in health, inequality, or undeserved healthcare, and providing the care and support that every person needs to succeed.
Thank you very much for sharing, Sam. And you know, we have so many people in the room in listening mode. So I hope your words were heard as well and will be taken to other places to spread the word about. And we have two more young person to hear from in this panel. The next is Teodora Mileska. Welcome to our panel. Teodora is a vocal activist for human rights with a focus on sexual and reproductive health rights on a national and international level. So you are a peer educator, as I heard, and an educator for comprehensive sexual education. And we would like very much to hear your experiences as well. If you could tell us your story.
Yeah, so I've been a peer educator for more than 4 years, nearly 5. And I have come to, in contact with so many young people, and I've had the chance and opportunity to hear their stories. And something Sam mentioned, and also Amanda, our healthcare is not accessible to young people. We are having youth centers, accessible and youth-friendly centers, but they are not enough. There are mostly one per city, mostly in the capital city of our countries, and they're not very much accessible to the broader group of young people, which also to mention, it's not homogeneous. But what I want to talk about today, mostly to focus, is about menstrual disorders. It's a topic and a story of many young people out there. Women, for example, women are most likely to seek healthcare than men. But a 2018 study found out that doctors often prescribe their pain to being hysterical or over-emotional. And that it's obviously not coincidental that the role of this assumption comes from letting in our gender roles and gender stereotypes within our healthcare, which then endangers our health. Very common solution and treatment to menstrual disorders in my community is to get a diagnosis from doctor and to be said, you will eventually give birth and everything will come back to its place. And that is so wrong on many levels, but especially, thinking out that, having the assumption that every young person out there who has a uterus will have a child. That it's not true. And also my health should not be based upon my choice to have children or not to have children. And the other most used treatment is having the pill as a solution to, that fits all of us, which is also not true. So I think that, having funds and research put more into the menstrual disorders will be it should be a priority because a lot of people are facing that, and I think that it will it will help us to go beyond the gender gap that is happening within our healthcare.
Just one follow-up question, if you allow. Would you mind talking a little bit about the effect of the exclusion that you face, like on your immediate health or on the long term or on your opportunities?
Yeah, obviously the first one is living in pain. We don't want people living in pain. We don't want people to, the pain to be a barrier to them seeking help and them also filling in their full life potential out there. And as Amanda said, they're, living in pain gets, it's a barrier to a lot of other opportunities in life, whether that's education, whether that's economic opportunities, um, having, not having a treatment and not having adequate healthcare and adequate attitude from the people who are giving medical treatment will, in the long run, first of all, it will not give us to fill in our full potential. We would not be, equal in this society. And then again, it also can be life-threatening. So I think that when addressing the gender bias, especially in healthcare, we're addressing a much broader topic of having an equal access to healthcare and to a healthy lifestyle.
Thank you. And now I'm asking Yana, last but not least, from our panel, Yana Panfilova, who is a young person also from Kyiv, Ukraine. Yana was born with HIV, and at the age of 10, she discovered about her status, and she's a founder and chair of the board of Teenagizer. Yeah. She is the author of the report Key Barriers to HIV Testing for Adolescents in Eastern Europe and Central Asia, and she's first among Ukraine's top 30 under 30 by Forbes in 2020. So yeah, first of all, congratulations for that. And we would like to hear also from your story, like how were you excluded, or what was your experience of exclusion and how it impacted your life?
Thank you so much. So really happy to see you all, and I was really happy to join today. 2 days ago, I was in really interesting conference about the well-being and health in Brussels, which the Bill Gates Foundation, Medellin Foundation, their host. And also we will also talk about the mental health, and the more focused right now on the mental health in the Europe and also in the world. So I'm very happy to see that the mental health is raising on the topic, and we now have this discussion. So I'm from Ukraine, I'm 25 years old, and I was born with HIV, and until February 24, I thought that growing up with HIV was the biggest challenge I would ever face, but I was wrong. And now it's more 8 months of this war. Millions of Ukrainians have been living in new reality of death, tears, and fears. And for example, 2 weeks ago on Monday, Russia launched dozens of bombs against civilian targets in Ukraine. Most of them landed in the center of Kiev, where I was. This how Russia congratulated the world on the World Mental Health Day. And of course, it's really hard because every morning I was really afraid waking up to find the news when my grandma and my uncle may die from the Russian or Iranian bombs. Bombs in Kiev, where we are based. So and of course afraid the millions of young especially women and children who are fleeing in the other countries and just trying to survive and wondering what be left what would be left when we return to our home to Ukraine. And also it's really hard to all of us to see how this war to influence our well-being and health, and how mental health and how many disorders will be after and during this crisis. So now at Teenagizer, we are working a lot with adolescent and young people, especially with adolescent, because adolescent now it's much important, because sometimes when we ask, okay, what teenager's life is, and for example, many countries teenager cannot go to the clinic and ask for the help without the parents. It's a huge barrier for all adolescent and young people, living in many countries. So I think that the first inclusion, I think it is the first discrimination for the teenagers, and the second one, of course, when we are talking about the inclusions, what does it mean? What does it mean? Is this word inclusions? And I think it's it's really important to ask about the young people and teenagers. What does it mean, this word? I think for us of teenager, because we're still providing online peer counseling for many teenagers, young people, more than maybe 10,000. But how many young people, especially adolescent, other organization can even reach for this crisis? So it's a huge question for us. It's a huge question for global organization, and of course, I think the system peer-to-peer is it's very unique. It's very important if we're working with young people and adolescents. And I think we should also implement this system, because mostly we get using to work like as the old standards, where you sit and a doctor sit and we just talking. But honestly, it doesn't work, because teenagers can't believe with the doctor or other topics. And the third one, and the last but not least, it's about technology. Unfortunately, in all the medical spheres, I can see how the technology we use, because many teenagers, like young people, living in their phones. And it's easy to ask Dr. Google than ask the real doctors, yeah? And so we also should think how we can manage and how we can influence these new technologies to be more inclusive, to be more open, and to be more friendly to young people.
Thank you. And I have one more question to you. You started to answer it a tiny bit already, but I'm interested on how do you think young people can be part of the solution, or if you see something happening already, like what has changed, what is being changed now, or what should change in the future, and how can young people be part of the solution? If you could tell, both of you.
It's really a good question. Thank you for this. Every time to talk about the like meaningful engagement of young people. So maybe today I have asked for the WHO, how many young people working on your space? If we would like to really talk about the youth really engaged, it's not only for you, WHO, it's also for the global organization, this question. Because if we would like to talk about the real participation of young people, we think about how many young people they're working, how many young people are going to be a doctor and to be a doctor, because it's also a matter for the better life.
Thank you. Theodora? Yeah.
I think that young people are already making some changes, and I think that we need a lot more support from international organizations and recognition on the work that we do. So I think that young people can really help in delivering education to medical staff who are working primarily with young people, and addressing, the diversity and the different barriers that young people face while accessing different healthcare institutions.
Thank you. And now, as a last round, to all panelists, including Amanda, you're also part of the panel, although we are listening to young people right now. But if you had an opportunity to tweet something, to give a message from what we have been discussing here today, what would that be? Can we start with Stan, maybe? Yeah? And then whoever would like to.
If I had to send something to the young people, it would be, especially if they plan to work in the healthcare sector, I would say from viewing in the aid for people with intellectual disabilities, it would be to inform themselves early, because new things are learned about intellectual disabilities almost all the time. So having them do their own research I feel would help them greatly in dealing with challenging behavior and people who might be nonverbal, who they find different ways to communicate with people, even for any patients that don't understand them when they use certain terminologies, to simplify it a bit or reword it. It does help. Even me communicating with other athletes that also train with me to help them understand, it helps a great deal.
Thank you, Sam. Anybody else from the panel? If you had a tweet, a message to share with the world? Yeah, Amanda?
Yeah, thanks. I hope you guys come in next because I don't want to go last. But I think if I had to tweet something, I mean, first would be a big thank you. I mean, both to the organizers, but everyone that's participating in the session and panelists, because it's just so great for us to hear.
You would tag them in your tweet,
from
right?
you. Yeah. I mean, everybody, right? This is how you get the word out there and retweeting and sharing and whatever. But yes, a big thanks. But also the comment on the practices and attitudes. This is something that people feel like has to change. It's not just a money issue. And I think that, for me, would be summarized in taking the time, like just taking the time to think about somebody else's experience, not just your own. And that empathy piece, I think, is really, really important to that. So taking the time. And I think the third thing I would invoke is some comments that Vesna, I know from Slovenia, made the other day, who's on the executive board for WHO, saying, keep getting organized. So hearing these voices from young people is critical, and making sure that they're organized and channeled and regular parts of our policy process are critical. So just to encourage young people to keep doing that. And I look forward to continuing to listen. Thanks.
Thank you. Yes, Jana?
So if we are talking more about the mental health, so I would like to say mental health is not only about health. Mental health is social justice. Mental health, it's about human rights. And we also think about also this, and it will be included on our mindset. And the last one, I would say, yeah.
It's okay. We can circle back if you want. And then Theodora?
Yeah, I'm very happy that you asked for a tweet and not a TikTok video. It's much easier to come up right on the spot. So yeah, as Amanda said, and as the audience agrees, we need a change in attitude. So I would definitely say gender-sensitive training now. That will be my tweet.
Okay. And Jana, to
And
complete?
to finish, I think we also need to include for all our program talking about the emotions, because I think the huge gap between the doctors and teenagers, because the doctors doesn't understand how to talk with teenagers, because they doesn't sometimes understand about the emotions, and I think it would be very, very useful, and also include a new subject, because what we are dreaming, and my team, like I think, where we're talking with teenagers, they create new subject about the emotions, because times are changing, and I think it's very helpful in the next decades for teenagers. Thank you.
Okay. Thank you very much. And I would like to thank you for taking part in this panel. What I got from your tweets and would like to reflect back to the audience is, like I heard, do your research as one important message, and that goes for all of us, I guess, right? If we want to be inclusive, we all need to do our research in whatever field we are working. Then take time. That goes also for many occasions when we meet different people. Yeah, we heard that also in the previous panel. You know, making people feel safe. Time will help with anxiety as well. So it's, you know, it's also a good tool that you can use in many contexts. And then the human rights perspective, and if I mix them all in all together, I think we heard a lot about empathy today. Yeah, that we need to exercise empathy towards one another. So thank you very much for sharing and to be with us in the panel. And for the audience, I would like to encourage you to go to our last interactive sessions. After lunch, there's going to be 3 options that you can choose from, and I hope you're going to make your voice heard again. And then we are welcoming you back for the closing session this afternoon. Yeah, thank you very much for being here. And thank you once more.